So we have this fascinating story here and frustrating for a lot of these patients. A doctor in Moncton who says that these patients have some sort of condition that's linked, some sort of neurological disease that seems specific to these people in New Brunswick. And now this review says that doesn't exist. So we want to turn to Dr. Samir Gupta to get some analysis on this. What do you think, Dr. Gupta, of this? Like, it's like two completely different explanations about what's going on. What do you make of that?
Yeah, and I think it's really tough for the patients and the families. But, looking at it from the outside in, you have this one neurologist who really firmly believes and has talked about this theory that there's some type of external exposure that links these folks. But it's grown from New Brunswick to now all the Atlantic provinces, to Quebec, Ontario. There are cases in Alberta. So how realistic is it, from the outside looking in, that there's one exposure that only Canadians have, but it's an exposure that people experience across the country, and you have a lot of external evaluation now. This isn't the first one. In 2021, there was an epidemiologic study that looked for a common exposure, did not find anything. In 2022, 6 neurologists looked at 48 of these cases. And again, in 40 of those 48, they found these very common conditions as explanations. And now you have this very thorough analysis of 25 cases, and every single one was explained by a different diagnosis. And it was done very properly. You had a movement disorder neurologist, a behavioral neurologist, independently assessing cases. You had the pathology assessed by 2 different neuropathologists. And none of these folks had a vested interest in validating or invalidating this theory. They were just after understanding the diagnosis. So I think we're really at a point where the science is quite clear that independent evaluations show that there isn't one, unifying mystery diagnosis. These are otherwise pretty common conditions that these folks had.
So let's talk a little bit about what you just mentioned about the independent analysis, because I think as all of this was going on, there was a concern that maybe the quote-unquote medical establishment or the government in New Brunswick was trying to hide the truth here. Based on what you've seen of this analysis by outside doctors, are you concerned at all that the truth is not being properly looked into?
I'm not, Ian. And, it's been looked at, as I said, so many times by so many independent people that would have no reason to want to suppress something, that are after understanding what these folks had. And I think that, it does get very tricky. What happened here? Why did this happen? I think there's this concept of confirmation bias. This neurologist thought that there was something going on, that there was something new or mysterious. And then you get into this confirmation bias where when you look at a set of symptoms, you may only look at the symptoms that confirm that theory and disregard the symptoms and the part of the history and the test findings that don't go with that theory. And that's sort of, one of the biases that we all have as people. And then I'm thinking of the patients. It's very tough when you have these symptoms, your loved one has these symptoms, and you have somebody who's championing this idea that there is a cause for this. Someone caused this. It's not neurodegenerative diseases like Alzheimer's or Parkinson's, which just happen. So it becomes very attractive to sort of buy into that. And I think, as you say, there's a conspiracy theory that came around this. And this happened at a time where there was a loss in trust in institutions. This happened around COVID times, where people were not very trusting of governments. And I think this sort of fell into that. And it's very unfortunate that it sort of grew from that and became what it is today.
Yeah, and I've seen other examples of this. We don't have time for kind of all the background, but years ago I covered a story near Vancouver where people felt a series of symptoms were based on exposure to pesticides, and the scientific analysis suggested the same thing this one did here, that it was a group of symptoms of other things that all kind of overlapped and weren't due to one common cause. But one final thing. So in this case, we have this independent outside study which has said that it's not all one common cause and not a mysterious New Brunswick ailment. But for patients or families of patients who get a diagnosis and aren't comfortable with it or want a second opinion, what would you say to them about second opinions?
Yeah, I think second opinions would have gone a long way in this case. It's alarming that a lot of people didn't want a second opinion, and that sort of speaks to this idea that people are worried that there is a conspiracy. But, for most of us who practice, either when we're uncomfortable as providers with the diagnosis, or when we see that our patients are not comfortable with the diagnosis we've given, we encourage them to get that second opinion. We want our patients to be confident with the diagnosis so that they can move forward with the treatments. I think a second opinion would have saved a lot of people a lot of pain in this case. Second opinions aren't always easy to get in our system. I will say that. They're not always accessible to folks. If you're a patient out there, you're not confident with the diagnosis you've been given, or you're not being given a clear diagnosis, ask for a second opinion. Patients are surprised by this, but most doctors are not offended by that.
Yeah, and if they are offended, that's probably a bad sign, right?
And that's an even better reason to find a different doctor.
Yeah. Dr. Gupta, thank you for your opinion on this. I really appreciate the analysis.
Nice to see you. Thank you.